most important findings in our universal breast cancer genetic testing registry that was published in December in the Journal of Clinical Oncology was really that there was no statistically significant difference in the pathogenic variant rate between patients that met NCCN criteria for testing and those that didn't meet NCCN criteria for testing. What that means is the guidelines are not good at picking out the majority of patients that have a pathogenic variant. That led us to conclude that all patients with breast cancer should be genetically tested in an expanded panel. One of the exciting things surrounding our paper published in the JCO was that the American Society of Breast Surgeons convened a group of their members to look at their genetic testing guidelines that they recommend to the members of the society. They decided to radically change their guideline recommendations for genetic testing to include all women who are diagnosed with breast cancer, not just the ones with family history, not just the young ones, not ones with a particular type of breast cancer, but all patients with breast cancer. After we completed the Universal Breast Cancer Genetic Testing Registry, we were looking to continue to push the field forward. And the natural follow-on to that study is the IGAP study, the Informed Genetic Annotated Patient Registry. Now that the guidelines have been broadened, we're going to be testing all breast cancer patients. We're also going to be adding in patients that don't have a cancer yet, that may have a high risk of breast cancer based on risk models. The IGAP it's going to be following patients not just at the time of their genetic testing, but over the course of the upcoming years in their life. We're going to be including not just patients that have pathogenic variants or deleterious mutations, but also patients that have variants of unknown significance. We want to get some patient-reported outcomes. There's lots of things going into the registry that we're excited about. The main ones are following people over time for their genetic pathogenic variants and confirming and building on what we did in the Universal Registry. We think that the IGAP registry is going to really serve our patients well and really lead to some interesting and hopefully practice-changing discoveries.